If you're over 70, chances are you've heard this phrase more times than you can count. This test is mandatory. But here's a question most people never stop to ask. Mandatory for whom and for what purpose? As we age, medical care often becomes more automatic, more screenings, more procedures, more follow-ups. And while many tests are absolutely valuable and life-saving, some are ordered out of habit, not necessity, especially in older adults. Here's the uncomfortable truth. After 70, the risk-benefit balance of certain medical tests changes. A test that makes sense at 50 may offer very little benefit at 75, and in some cases it can trigger stress, unnecessary procedures, or treatments that don't improve quality of life. This doesn't mean avoiding doctors. It doesn't mean rejecting medicine, and it definitely doesn't mean ignoring your health. What it does mean is understanding that good healthcare after 70 is about personalization, not one-size-fits-all rules. In today's video, we're going to talk about 3 commonly labeled mandatory tests that many seniors are encouraged to undergo, and why it may be reasonable to pause, ask questions, and have an informed conversation with your doctor before automatically agreeing. These are not secrets. They're discussed in medical guidelines, but rarely explained clearly to patients. My goal isn't to tell you what to refuse. My goal is to help you think critically, ask better questions, and make choices that align with your health goals and quality of life. Before we begin, tell me in the comments, have you ever felt pressured into a medical test you didn't fully understand? Let's start with the first one. Before we talk about the 3 medical tests, there's something essential you need to understand. Questioning a test does not mean refusing care. It means practicing informed, personalized medicine. Medical guidelines are designed for large populations, not for you as an individual. After age 70, factors like overall health, mobility, existing conditions, life expectancy, and personal priorities matter far more than age-based checklists. Some tests are excellent at detecting abnormalities, but detecting something doesn't always mean it needs to be treated. In older adults, this can sometimes lead to what doctors call overdiagnosis, finding conditions that would never cause harm, yet trigger stress, repeat testing, or unnecessary procedures. This is why many professional medical organizations now emphasize shared decision-making, especially for seniors. That means you and your doctor weigh the potential benefits of a test against its risks, discomfort, and impact on quality of life. So as you watch this list, don't think in terms of, should I refuse this test? Instead, think, is this test right for me, right now? Your health is not a checklist. It's a conversation. With that in mind, let's look at the first test many seniors are told is mandatory and why it deserves a closer look. One of the most commonly labeled routine or mandatory tests for older men is the PSA blood test, used to screen for prostate cancer. For decades, men were told this test should be done regularly, often every year. But after age 70, the conversation around PSA screening becomes much more nuanced. Here's why. The PSA test does not diagnose cancer. It only measures a protein level in the blood that can rise for many reasons, including benign prostate enlargement, inflammation, infection, or even recent physical activity. In older men, PSA levels naturally increase with age, which makes false alarms more common. The real concern is what happens after an elevated PSA result. In men over 70, prostate cancers detected through screening are often slow-growing and may never cause symptoms or shorten life. However, once a PSA comes back high, it can trigger a cascade of follow-up tests, biopsies, repeat imaging, and sometimes treatment, each carrying its own risks. Prostate biopsies can cause pain, bleeding, infection, and anxiety. Treatments such as surgery or radiation may lead to long-term side effects like urinary leakage, erectile dysfunction, or bowel issues, outcomes that can significantly affect quality of life. This is why many medical organizations now recommend that PSA screening not be automatic after 70, especially for men without symptoms or those with other health conditions. Instead, they emphasize individualized decision-making. The key question becomes, will finding this cancer improve my life or complicate it? For some men, continued PSA testing may make sense. For others, especially those prioritizing comfort, independence, and quality of life, it may be reasonable to pause and discuss alternatives. Pushing back doesn't mean refusing care. It means asking informed questions and making choices aligned with your personal health goals. Another test often described as routine for older adults is the screening colonoscopy. For many years, regular colon cancer screening has saved lives, especially when started earlier in adulthood. But after age 70, and particularly after 75, the decision to continue routine colonoscopy deserves a more thoughtful conversation. Here's why. A colonoscopy is not a simple blood test. It's an invasive procedure that requires bowel preparation, sedation, and recovery time. In younger adults, the benefits usually outweigh the risks. In older adults, however, the balance begins to shift. First, colon cancers typically grow very slowly. In seniors with limited life expectancy or multiple chronic conditions, a cancer detected today may never cause symptoms or impact longevity. At the same time, the risks of the procedure itself increase with age. These risks can include dehydration or electrolyte imbalances from the bowel prep, reactions to sedation, bleeding, or, rarely, bowel perforation. Even mild complications can be harder to recover from in older bodies. Second, if a colonoscopy finds small polyps, it often leads to repeat procedures and long-term surveillance, even when the likelihood of benefit is low. This can create a cycle of testing that adds stress without clearly improving quality of life. Because of these factors, many professional guidelines now recommend individualized decision-making for colonoscopy after 70-75, rather than automatic screening. Doctors are encouraged to consider overall health, functional status, previous screening history, and personal preferences. Important questions to ask include, have I had normal colonoscopies in the past? Do I have symptoms that truly warrant this test? Will the results change how I'm treated? For some healthy, active seniors, continued screening may still be appropriate. For others, especially those who value comfort and simplicity, it may be reasonable to step back. Again, pushing back doesn't mean declining care. It means choosing care that fits you. As we come to the end of this video, I want to leave you with one clear message. Good healthcare after 70 isn't about doing more tests. It's about doing the right tests. The PSA screening, routine colonoscopy, and stress testing we discussed today are not bad tests. They can be life-saving in the right person, at the right time, for the right reason. But when they're done automatically, without considering your overall health, your symptoms, or your personal priorities, they can sometimes create more harm, stress, and confusion than benefit. Aging changes the equation. After 70, quality of life, independence, and comfort matter just as much as detection. That's why modern medicine increasingly emphasizes shared decision-making, thoughtful conversations between you and your doctor, rather than one-size-fits-all checklists. Pushing back does not mean refusing care. It means asking questions. It means understanding why a test is being recommended, and what happens if you say yes or no. Before agreeing to any test, consider asking, will this test change how I'm treated? What are the risks at my age? Are there safer or simpler alternatives? Your health is personal. Your care should be too. If this video helped you think differently about your medical care, please subscribe for more senior health guidance focused on clarity, independence, and informed choices. We publish new videos every week to help you navigate aging with confidence. And I'd love to hear from you. Have you ever questioned a medical test? Or wished you had? Share your experience in the comments. Your voice matters. Thank you for watching, and take care of yourself wisely.